Hi, and welcome to Vital Voice. Lend us your genius and we'll give you a voice. My name is Maria Denzer, and I'll be your host for today's session. My guest today is Dr. Jennifer Repac. Dr. Repac received her veterinary degree from UC Davis.
Sorry.
I'm sorry?
Repac.
Repac, excuse me. I'm so sorry. Has spent 2 years teaching and practicing in Beijing. She did a residency at the acclaimed Animal Medical Center in New York City. Dr. Repac has also taught at STAR conference, where you had the privilege of her speaking with us. And one of her latest ventures is becoming a teleconsultant on VitalVet. Welcome, Dr. Repac. How are you today?
Doing good. Thank you for having me.
Okay, we're kind of thrilled about it. We're going to jump right into some questions for you. The first one I have is that we see from your background that you completed it in integrative and rehabilitative medicine specialty. What exactly does that mean?
And so what that means is that I started with a 1-year specialty internship at the Animal Medical Center and then proceeded to 3 years of a residency program, specifically mostly training and rehab, but we do an integrative approach, meaning that I also have experience and training even before my residency in acupuncture. I also recently got certified in chiropractic, and I'm also certified in Chinese herbal medicine. So we just take all the tools in the box kind of approach to how we do things. And rehab is one of the things that attracts me to rehab, is it just blends so well with so many different modalities.
Yeah, it really does. So how exactly would you treat an animal differently than, let's say, a general veterinarian, general practitioner?
So I think that you don't know what you don't know, and I nothing against general veterinarians. Actually, I practiced general practice for, I guess it was 3 or 4 years, coming into my specialty internship and my residency, and so I just have a little bit more of knowledge in terms of different ways you can approach something. So, if maybe medical management might be the only way that a general practitioner might view how to treat arthritis, for example, and not know about how exercise is such an important part of arthritis management, or a lot of mobility issues. And I can say, from my perspective, from before I started doing this training, that we did not have any training in terms of rehab at UC Davis, which is, a pretty good school. But it's just not core. It's still, unfortunately, still not core part of our learning. And so that's where we come in, and we're able to just look at things and from a different angle. And actually, it's more often than not, actually clients are looking for that other thing that they can offer their pet that they're not getting at their general practice.
Well, so it's more of a complete overall look instead of just the symptom. Mm-hmm. Very cool. Okay, so tell us about a typical work week. What kind of animals do you see coming in, conditions, treatments, things like that?
So I'm a little bit in transition, but I can say prior to me moving to Florida, back when I was in New York City, we have mostly companion animals. So mostly dogs is our primary population, a lot of geriatric medicine, a lot of neurologic patients and orthopedic patients as well. And then we also had an exotics department that was run by Dr. Quisenberry, who's well known in the veterinary field. And so we would occasionally have some rabbits. We had a chicken one time. And then we also have some cats as well. Although cats, people usually don't think of cats as much. Actually, just recently, for better or worse, cats have now been added to our exam for residency. So now they're going to be more integrated into our core curriculum. But cats are their own thing.
As someone else said, it was like trying to hold down a greased pig, to examine, and they're a little squirrely and trying to.
It depends on the cat. It's totally. I just say cats determine their own treatment. It's up to the cat.
Okay, that's right.
So if the cat's like, I'm not having any of this, then you're not going to get anywhere.
One of those cats have people. That's right.
But then there's some cats that are just wonderful, and they're food motivated. We've had cats go in the underwater treadmill. We had a cat. She was 18 years old. She'd swim in the underwater treadmill. I mean, incredible.
Wow, that's pretty cool for an 18-year-old.
Yes, it's pretty cool. She's spicy too. She complained a little bit, but she's pretty good.
That's good. So more geriatrics. So the treatments that you give is just, it obviously depends on the condition or the animal, but anything particular. So did you guys do a lot of surgeries, rehab from surgeries like ACL, or TPLOs, rehab stuff, or was it just, a geriatric is coming in and you're,
We do. We actually see all permutations. So we see some dogs before they go to surgery, some dogs after they come to surgery, some dogs that don't want to do, the owners don't want to do surgery. And so every, or we've had some that, that we tried the conservative route and then we end up referring them for surgery. So it's whatever is best for each patient. And sometimes age is a factor in what, if a patient is, if they have other issues as well, determines whether or not they're candidates for surgery. But definitely a lot of all of the above, total hip replacements. We had dogs that had TPLOs. Those are our most common ones.
Yeah, my lab had 2 of them. I'm very familiar.
Oh, geez.
So we're going to switch gears. What kind of, you're a virtual consultant now. What do you think are the benefits of virtual consults?
Well, actually, I can say that I have, from all of this craziness with COVID, AMC being in New York City made the decision to close our department for a good amount of time. So actually, we were very reliant on this type of platform for patient care. And I think rehab in particular is one of those specialties that you can actually do quite a bit. I was pleasantly surprised at how much we could accomplish, even though I was not physically there. And so, sometimes, especially if it's somebody that I don't know, a lot of people just want to listen, or maybe they want someone to listen to them, or they want someone to maybe just sit there and communicate what different things could be, and maybe that's something that they're not getting in the other practices they've seen. And a lot of things that we do, I can assess patients to a certain extent based on visual assessment of their function. And so, I mean, you kind of have to toy with the camera and get the angles right, because everyone wants to give you the bird's eye view of the dog, which is not super helpful. But once that aside, I mean, I actually was able to really help a lot of my patients throughout their time at home and guide them through exercises and things like that.
Okay. So is there anything specifically that you can discuss, recommend? Do you find it easier, harder to, more at home so you can see their home? Is it easier to recommend certain, whether it be exercises or stretches or anything like that, or modalities that they can use that you can see? Do you find it a benefit that way as well?
I mean, I think it all depends. I think we do have to tread carefully, because if there's a dog that's limping, there's no way that I'm going to be able to tell the owner with 100% certainty what's going on. Somebody's got to put hands on the dog, and somebody's got to probably do some x-rays or some sort of imaging to figure out what's going on. That being said, if I'm equipped with a prior diagnosis, I might recommend or walk the owner through what are the steps to getting a diagnosis. Maybe they go off and get a diagnosis with a vet or a specialist. And then once they come back to me and I am equipped with what's the condition that we're treating, then I can definitely help guide return to activity, or whether it's strengthening, return to activity, or just safety management in the home.
Okay.
And also owners love manual therapies too. So
yeah, I like to get involved myself. Yeah. And you can see the bonding experience that happens when you do take on that experience, that responsibility.
I mean, often I actually find that my owners are, whether it's appropriate or not, doing some sort of, trying to do some sort of manual therapies at home. And they just need a little bit of a guidance in terms of what direction to take that in.
Now, let's talk about your strengths for a moment. Like if I wanted to say, okay, my pet would benefit from a virtual consult with you, with Dr. Repac, she would have what? Like fill in the blank. What would be your specialty that you would want somebody to contact you via virtual consult?
I think that I would have the best perspective in terms of what would be, how to prioritize the best treatment for a given condition. So if, like I said, if we had a diagnosis, or I can also guide how to get that diagnosis as well as the alternative. But if we had a diagnosis, let's say like a cruciate tear, sometimes I find a lot of owners are overwhelmed. They go online and they see like, okay, I saw this person treated the cruciate tear with acupuncture. So is acupuncture the only thing I should be doing? And I think that given my experience seeing the kind of the gamut of what there is to offer, I can prioritize what is most important. I mean, of course, acupuncture is important, but strengthening is definitely higher priority for stabilizing the knee. And so, and also having that perspective of, the doctor's perspective of like, are medications necessary at this point? Like, I would not prescribe a medication virtually, but when a lot of owners are afraid of using pain medication, and I could probably say from watching an animal that they should listen to their vet and take the medication versus maybe go and seek a prescription.
Right. Okay. Very good. And there's anything that you would recommend, just generally speaking, after a consult? I would guess compliance from an owner would be number one. But there's anything in particular, do you think follow-ups are important? I know it depends on the situation. Like for instance, if you were just doing, a quick, hey, let's just adjust that or whatever, versus, somebody who's going to see you for rehab for over an extended period of time. Is there anything else that you would recommend somebody doing afterwards, like the follow-ups, things like that?
I think follow-ups are important for both parties. I can say from my experience, I mean, the people that I was doing the virtual consults with, most of them are people that I knew already, but sometimes they would say, hey, this exercise didn't work, and we'd have to go back and do another another recheck consultation and just kind of review how can we modify this exercise to work for the pet. I think that you just get better results if you're able to kind of come around again. Of course, if it's a one-off, like, what do I do? My dog is limping. Who do I see? That's, then I can, send them off, and that's a different kind of case. But especially for exercises, follow-up is very important.
Yes, agreed.
And you also want to make sure, the exercises, especially if you're looking at an animal that's expected to recover, you start off with the baby exercises. And then once those are too easy, you want to graduate to a higher and higher level. And so that's the important job of the rehab therapist, is to assess, is this dog ready for the next level, or are the exercises being done properly? And I witnessed many interesting DIY exercises at home virtually during COVID as well. A lot of owners want to bring the bar higher on the cavalettis, which are the poles, for example. But when a dog is hopping over the poles, it's not exactly what I want when I'm trying to move each leg individually. Right. Things like that.
Yeah. Okay, so there may be a few vets that are watching and wondering about if this service steps on the toes of the VCPR, which for those guys out there who don't know, it's a veterinary client-patient relationship. What are your thoughts about this?
That's a good question. And I think that, veterinarians in general, and I can say I've worked in a variety of practice, we tend to be afraid of technology and slow to change. And so it can be scary sometimes when these things happen. And I think that there's a correct way to do it, and then there's an incorrect way to do it. And definitely I do not see myself, like I said, making diagnoses virtually. I do not feel comfortable. I do not feel capable of doing that. I can give a priority likelihood list, but then in the end, I'm always going to send them back to an in-person veterinarian, whether it's a specialist or a GP, for follow-up care. And it's just like, well, working in a referral practice, you also don't want to just take your patients in and never give them back to, where they came from, because that is also not good professionalism.
That's correct. Yeah. Tell us about one of the most rewarding client experiences you've had, like the underdog that made it kind of thing, or one that just got you, that just, or it just pulled in everybody's heartstrings.
Oh, well, there's so many, but I was thinking about this, and I have to say it's got to be Stanley, who he was. I know, his fantastic name, and of course Stanley was he's a senior beagle. He has to be an older man.
Name for a beagle.
Who and no offense to beagle owners, but he's a very quiet beagle. Very mild mannered, and the cutest, absolutely cutest. And he was hit by a car. I think he was hit by a car in Central Park, actually, which happens surprisingly frequently in New York City. And fractured his pelvis in multiple places, suffered nerve damage in one of his legs, or he was just dragging. He was dragging actually both of his legs, but one of them was more affected than the other. And so he underwent surgery to stabilize his pelvis, and his surgeon basically said that he didn't think this dog was going to walk again. And he just, he was sent to us as a last-ditch effort, like, fit this dog with a cart,
Okay.
And then whatever voodoo you do, right?
Yeah.
So, but he was very lucky to be owned by a wonderful owner who was very dedicated, and she, very compliant, followed all the instructions. We enrolled him in rehab, got him in a cart, which he graduated from over time, which is wonderful. And he also got some assistive devices, so special little boots to help keep his toe up, because he was having problems with keeping his toe in the proper position. And just every step of the way, I mean, we managed him so closely. And he also had acupuncture, and I would do a little bit of chiropractic with him when I was doing his treatments, and he just did phenomenally. I mean, he's a walking dog. He's like, and we just love to take that video and show it to the surgeon, because yeah, we would never guarantee, and often you don't know in the beginning stages. And I've heard neurologists say that nerve regrowth is like watching paint dry on a wall. It is, especially if you're the one cleaning the diapers and all the stuff at home.
Yep.
But he's so great. I love seeing him.
That's fantastic. That's great. What a great story. And what I just want to end, people have to know your little side business.
Oh,
because we think it's fantastic, and this is it's really cool. So why don't you tell us a little bit?
So I have a website called drglittersparkle.com.
Awesome name.
It's just like, I wanted it to be, an alter ego, but then also incorporate bits of who I am. And I make crafts. Right now it's mostly it's all masks that are just non-medical masks, but a lot of veterinarians have been using them around the hospital because we're all wearing them when we go to work as essential workers. They're very comfortable. They have a great fit, unlike a lot of masks, and I have a variety of—
You make these yourself, correct?
I do. I sew them myself, and that's what I did, because there's, besides studying, this is my study break, I would just make masks during COVID when the world was falling apart outside. And and so I'm about to set up my factory again, and I also make candles and and these diffusers, essential oils diffusers. So stay tuned. There will be more varieties.
The website's going to be growing. All right, and that was— I'm sorry. Say it again. The name of the website was drglittersparkle.com. Oh, that is— what a great name. I got it. Fantastic. It really is. Well, I thank you so much for joining us today. We look forward to getting you loaded with virtual consults, and good luck with your move as well.
Thank you so much.
Thank you, Jen. Take care so much. Thank you, Dr. Repac. I really appreciate your time.